All right, again, thanks everybody. This is Tim Gutwald, and we're going to discuss revisiting the Provider Relief Fund. I gave a presentation on this, way back when the CARES Act originally was passed, back in, I believe, April of last year. So a few things have changed since then. And we're kind of coming up on a time period where there might be some reporting for how you've used those funds, if you've got them. So we're going to kind of recap a few different things and go over it. So here we are to revisiting the Provider Relief Fund. Again, I kind of mentioned, we'll start off with a recap of the fund itself. There were, as you might recall, there's been 3 general distributions, and then there's been some targeted distributions. So we'll discuss those, and we'll briefly mention the uninsured fund. We also, then we'll kind of move on to a bit more of the meat of the program where we have fielded most of our questions on the Provider Relief Fund, dealing with compliance with terms and conditions. So we'll talk about how you can use the funds, your eligibility, those type of issues. We'll also talk about interactions with PPP loans and other funds. A number of providers have received funds from a couple different sources, generally PPP and the Provider Relief Fund. And so we fielded some questions on, all right, how do I use these? I don't want to get in any trouble, and we'll help guide you through that. And then last but not least, we'll talk about the reporting requirements, deadlines, and documentation that you should hang on to. All right, as you might recall, the CARES Act created or added $100 billion to this Provider Relief Fund. Again, this was, back in April. At that point, hospitals around the country were not permitted to perform, a large variety of procedures. Dentist offices were closed down, and so the government was looking to provide some relief to those entities, and they added $100 billion to that fund. There was not a lot of language. As you might recall, the CARES Act was passed fairly quickly. There's not a lot of language and guidance on that, and so over time, HHS has provided some additional guidance that makes it a little bit easier to maneuver these waters. Ultimately, there ended up being $175 billion allocated to the Provider Relief Fund. Distributions are made to eligible healthcare professionals, and we'll get a little bit more detail of that. But generally, really, almost anyone who provides any sort of healthcare, physicians, hospitals, suppliers. The funds and the use of the funds was tied to provision of care for individuals with possible or actual cases of COVID-19. And at the beginning, there was some concern about precisely what that meant. Obviously, not everybody is going to be treating people with COVID. Not everyone's going to be testing people for COVID. And so the question was, am I still eligible even though I'm not sort of on the front lines of this COVID-19 battle? And over time, we learned from HHS that they're going to define this very broadly. So that alleviated a lot of concerns on that front. And then the money can be used for related expenses or lost revenues attributable to coronavirus. Again, that has been provided additional guidance from HHS, and it's been kind of viewed very broadly, which is very helpful. So the Provider Relief Fund has been distributed through sort of 3 phased distributions and then several targeted distributions. The first phase 1, again, happened way back in the spring. Money just kind of started showing up in the accounts of hospitals and physician groups. There was about $50 billion, mostly based on Medicare payments. And so that caused some people to be concerned. It tended to benefit hospitals and those larger providers a little bit more, because they're quite dependent on Medicare payments as opposed to, say, commercial payments or Medicaid. Some of those concerns were addressed in phase 2, which sent more money to Medicaid providers. And then phase 3 was this fall, where an additional $24.5 billion was sent out with new money for 2020 providers. So if people started up a new practice in 2020, they would be eligible for that money. And then the other aspect was targeting behavioral health providers as too. And phase 2, I should mention, included distributions to dentists as well. And really, then in addition, there was numerous targeted distributions to rural hospitals, high impact areas, so the kind of areas with a large amount of COVID who got hit hard by the pandemic. Skilled nursing facilities and tribal hospitals were given targeted distributions as well. If you received one of those targeted distributions, your reporting obligations are going to be a little bit different than what we're going to talk about here. And feel free to give me a call if you receive one of those, and I'm happy to go over that with you as well. And then there's also an additional amount of money was set aside for testing and treatment of the uninsured. There's HHS created a portal, as we'll kind of figure out as we go through this. They've created a whole lot of portals over the last year for these various programs, but they have an uninsured portal that you can use to request reimbursement. And kind of tying in a little bit to our presentation from last week, you can use that portal to request reimbursement for vaccinations of individuals who are uninsured, because as we mentioned last week, you are not permitted to charge people sort of at the point of service. You can charge, payers and Medicare Advantage plans for an administrative fee. But if an individual shows up, is uninsured, then you're still required to give them the vaccination and not permitted to treat them. So you would seek reimbursement through this portal. All right, kind of moving on to the compliance with the terms and conditions. So the first obvious question that we received all the time when this first was announced, who's eligible? And really at this point, most providers around the country were eligible by phase 3, hospitals, physicians, rural health clinics, dentists. As long as you build Medicare, Medicaid, or even assisted livings and behavioral health providers who billed insurers of March 31, 2020 are all eligible too. You must have filed a tax return over the last 3 years in order to be eligible as well. That permits the government to sort of verify that you still exist and are operating, as well as get an idea of your revenue. And the other thing is you must have provided patient care after January 31, 2020. Obviously, the purpose here is to help practices stay in business. And so practices that have shut the doors and not reopened must return that money. And then, also you have to provide your tax ID number in order to be eligible as well. You'll submit that information and apply through the portal. So you'll get the money, and then within 90 days of receiving the payment, you'll be required to go back onto the website and sign an attestation saying that you're going to agree with the various terms and conditions attached to the funds in the program. Among those here, we'll kind of highlight the main ones. You must have provided diagnosis, testing, or care for actual or possible COVID-19 patients after January 31st, 2020. So again, if you close your doors and are no longer operating, you're not eligible. As I mentioned earlier, people were kind of concerned as to what exactly that meant, the diagnosis, testing, or care. But HHS has very clearly said they view every patient as a possible COVID-19 case for purposes of eligibility. And it's important to note that that's for the purposes of eligibility. When we get to a discussion about use of the funds and the expenses you can use, they do take a different tact. At that point, it's not, it actually has to be about providing care for COVID-19 as opposed to just any other patients. So again, this makes sense, at least in my opinion, as far as eligibility being tied to every patient being a possible COVID-19 case. When a patient comes to your office, obviously you guys know all the precautions that you've taken between cleaning, having people stay outside, putting up screens, providing staff with PPE, and any other number of precautions that you've taken, the telehealth, investing in that sort of technology. All of that is, directly tied to the fact that, people might have COVID when they come to your office, or they might be concerned that they'll acquire COVID if they come to the office. So they made eligibility quite broad here. Payments must be used to prevent, prepare for, and respond to COVID-19. We'll get into more. They provided a lot of guidance again, early on. wasn't exactly clear, what they meant by prevent, prepare for, and respond. I think we had some decent ideas, and our advice generally was that this is going to be applied pretty broadly. And honestly, even I've been a little bit surprised at how broadly the government views these categories, and cannot be used for expenses or losses that have been or will be reimbursed from other sources. And again, we'll get more into detail with that, but we're primarily here. Most of the questions I've gotten about this are, I got a PPP loan, I have these provider relief funds, what can I do? How do I make sure that I'm in compliance and not violating that particular provision? And the other aspect kind of that, is less addressed, and that we haven't gotten as many questions on, but the guidance is kind of touched on a few times, is that obviously money that you're receiving from insurers, for the payment of services you provide to patients, you're not going to use a provider relief funds to cover that sort of cost, although you can use it to cover sort of if it costs an extra $5 to see every patient, you can use the provider relief funds to kind of cover that gap. Again, so touching on only used to prevent, prepare for, and respond to COVID-19. Subsequent HHA's guidance shows that this has been interpreted quite broadly. They must be health-related expenses, and I'll get into a little bit more detail here on the next slide, exactly the type of expenses you can use. But, so you can't use this for marketing. You shouldn't be using this for landscaping, or, here we are in the winter for plowing your parking lot or walkways for patients. And you can't reimburse expense or loss from other sources. And again, so it's important to be strategic about how practices and hospitals are going to be applying these funds. You're going to have to submit reports to ensure compliance. And the other aspect of it is you must agree to public disclosure of fund amounts. As you've likely seen, there's been a number of news stories, more so in the PPP loans, about large companies, wealthy companies getting the money, or companies getting this money and then laying a bunch of people off. And so that's just something to keep in mind as you do things like lay people off, or as you talk about revenue and loss of revenue and things like that. Recall that people are going to be able to go back and see how much money your organization received as a result of the provider relief funds. All right, kind of get into the nitty gritty here on the use of funds. They need to be used to prevent, prepare for, and respond to COVID-19. Again, so you can fully expense equipment directly related to COVID-19. If things have gotten more expensive for supplies that you're already, you would buy that are unrelated to COVID-19, then that difference in cost can be used. The funds can be applied to that difference in cost. Some of the guidance, for example, talks about, it might be $5 more to see a patient. So you get $80, say it costs $85, you get $80 for every patient you see from commercial payers or Medicare or whomever. You can use that $5. Again, you're going to have to provide an accounting support for this moving forward, but you can do that. Obviously, sort of a more obvious example are masks and gowns and face shields and other PPE, cleaning equipment, upgrading heating, ventilation, HVAC, and air purifiers. At least my kids' school have purchased some certain expensive air purifiers. So if your office has done that, the provider relief funds could be fully expensed. That could be fully expensed to the provider relief funds. Now, this is kind of, I think, what made this next category here, general and administrative expenses, I think is what made things much easier for people from a strategic perspective. But HHS has said in any number of ways that you can use provider relief funds to address general and administrative expenses. So again, that includes mortgage or rent, malpractice insurance, property insurance, fringe benefits, so health insurance or other benefits for your employees. Again, you can use it to pay personnel, staff, administrators, support personnel. Again, we do want to recall, though, that this is supposed to be related to healthcare So if you have other staff that are not supporting your healthcare services in an administrative capacity, then you would not want to use the funds to pay their salaries. And then another one, IT. So a number of providers quickly ramped up their telehealth offerings as a result of this. They bought software, they bought hardware, they've had to pay for tech support, they've needed to add EMR modules or additional expenses to their medical records in order to be able to provide those telehealth services. Those are obviously would be appropriate to expense to your provider relief funds. And one thing that we've seen in the guidance as well is that the recommendation is you're supposed to apply funds to expenses first. And I kind of go over the order that you're supposed to do these things, but this is where you should be able to attach a large portion, at least based on my conversations with clients that I've had, a large portion of your funds should be able to go cover rent or cover mortgage, cover personnel costs. And that should probably cover most of it. But if it doesn't, again, so here's the guidance. So this is not just me telling you my interpretation of what the government has said, but it's quite clear here. Again, general and administrative expenses, mortgage, rent, those sort of things, you are permitted. Some places again have created outside spaces for COVID testing or perhaps vaccination. If you've done that, then expenses related to that could also be charged to the provider relief fund. At that point, you can now look to use those funds to offset lost revenue. So back on November 2nd, the government had issued some new guidance that said in order to calculate lost revenue, you need to compare 2019 to 2020. So you take September of 2019, we made X amount of money. 2020, we made X amount of money. You subtract the 2019 from the 2020 amount, and there's your lost revenue. Early on in the pandemic, they had said, well, you can also use projected revenue and to 2020. So you sat down, you did a budget at the beginning or the end of 2019, and you compare that to what you actually realized in 2020. And so you can actually do that now. You can now, the new guidance that came on January 15th says that you can use a budgeted amount of a projected budget for 2020, compare what you projected to what you actually received, and you can use that. You can also use a different methodology, an alternative methodology. I've kind of advised clients against that. I think you're inviting some unnecessary scrutiny. As a result of that, they're just going to kind of look more closely to that. And I think it's pretty easy. And in most cases, especially in those early months, the loss of revenue of actual versus what you received or projected versus what you received was, for many clients, was a significant amount of money. And again, so it would use up most of those funds. So one thing I want to point out is you can exclude payments that are not related to care provided in 2019 or 2020. One of the things we do here at Miller Johnson is we help providers collect from insurers or, even Medicare. We had a number of clients who were owed a lot of money by the VA. And so, we were able to get settlements for them, and they ended up receiving a decent amount of money. In 2019, you had called Miller Johnson, and we got a nice settlement for you in a no-fault case. You get $100,000 for care that was provided back in 2018. You don't have to use that number. You can remove that number from those 2019 numbers, although that doesn't necessarily help you if you were quite closed in 2020. There was some additional guidance that had come out, and it needs to be reasonable and necessary. Any expenses that you're using to support patient care efforts to prepare for, prevent, or respond. It's kind of wanted to highlight this reasonable and necessary language. Again, that's from that PDF that I just showed you right there. You can see there at the bottom, is this expense necessary and reasonable in business or to engage in some sort of expense unrelated to COVID-19, and certainly not any sort of personal luxury items or anything like that, that could get you in trouble down the line. You want to make sure it's kind of consistent with how you operate your business in the past. Again, so interaction with other funds. This is a question that we've received on a number of occasions. I got PPP funds, I got small business loan, I received other payments or whatever. So you're going to apply those other funds first before you then apply the provider relief funds. Again, I mean, I think in most situations, your mortgage, your rent, a lot of those other expenses are going to cover it. But, you apply your PPP loans to, lost revenue, or you apply the PPP loans to your personnel expenses, and then you start looking, your paychecks. That's with the PPP loan that'll help you get that forgiveness. And then at that point, you say, okay, well, I can top off this salary. I can, then I pay the rent, or I can use the rest of this to make myself whole from a revenue perspective. So you'll use your provider relief funds for that purpose. One thing to keep in mind is the provider relief fund can only be used to reimburse salaries up to $197,300. Again, I'm not the PPP expert. We've had a number of presentations, and I'm sure we will continue to have them for as we kind of move forward here. But you might want to use the PPP for some of your larger salaries, because the provider relief fund is capped at $197,300. Or if you have those PPP loans, you can use the provider relief funds to kind of top off the salary up to that amount if you've exhausted your PPP loan amount. Again, one thing to keep in mind is with the latest rounds of the PPP loan, the eligibility was tied to like a 25% loss of revenue. So one of the questions we received was, okay, well, if I use my provider relief funds to, make up for lost revenue, am I still eligible for the second round of PPP loans? And, the guidance has not been clear about that. But what we've been able to do for the clients that have kind of asked those types of questions is to remind them, okay, well, let's use the funds from the provider relief fund to pay for your mortgage, to pay for some of these other expenses, general and administrative expenses, as opposed to applying it to revenue. That way you remain eligible for additional PPP loans. So again, here's that order. Apply the other funds first, then you apply provider relief funds to expenses, then you apply provider relief funds to lost revenue. All right, so last but not least are the reporting requirements. So first, to start off, this applies to recipients of $10,000 or more. If you received under $10,000 or more, you can kind of say, thanks, Tim, I appreciate your time this morning, but I'm going to go have some coffee. But if you're like most of our clients who receive more than $10,000, you are going to have some reporting obligations tied to this. The good news is originally reporting for funds spent in 2020 was required between January 15th and February 15th. So if you had applied some of that money to expenses or loss of revenue in 2020, the government had said you're going to have to submit your report between January 15th and February 15th. And most clients were kind of taking their time, are going to do that closer to February. But as we got to the January 15th date, surprise, surprise, the government's portal was not working at that point. And so you can't submit any report whatsoever. The government has not provided any new dates as to when they think that the portal will be working and that reporting sort of function will be operating properly. I kind of think they might wait till July. Again, in the guidance that they've provided recently, they have said that you can continue to use the provider relief funds that you've received to cover expenses or lost revenue for the first 6 months of 2021. So we're going to have another 6 months here where you can kind of divvy up the money. So again, that's another reason to be strategic about this. If you don't want to prevent yourself from being eligible for other funds, if you can sort of stretch out your provider relief funds here into the first 6 months of 2021, it's quite obvious we're still going to be dealing with COVID for the next 6 months, you're still going to be buying PPE, cleaning, doing some of those additional expenses related to operating in our new world. So you'll be smart to kind of hold off and apply those funds if you can, as we move through this new year. But on the reporting obligations, you can register at the Provider Relief Fund reporting portal, and it's probably smart to do that at this point. The reason for that is because you're going to provide them, information about your business and email, contact information, and then they'll use that contact information to notify providers when they can complete that second step. So if you don't sign up, if you don't register, you're going to have to, rely on Miller Johnson, which is always a good decision, but you'll have to find out from some other way to make sure that you comply with that, the new reporting obligations. If they provide some date, if it's May or something like that. Again, I think that's probably not going to happen, but just take that one off your worry list. And one less thing to have to be worried about, and the government will let you know when you can file those reports. Earlier guidance indicates that the providers are going to submit some sort of like pre-populated report via a form online. So it's not going to be, you submitting your accounting documentations or some sort of homemade type report along with receipts or any of that sort of information. I sort of anticipate it being like, if you're going through TurboTax and reporting expenses related to your business or for your accountant, it's just going to be different categories of expenses, general and administrative. Oh, rent, X amount of money, personnel, X amount of money, fringe benefits, X amount of money, other expenses, PPE, X amount of money. So I think it's just going to be fields that you're going to be filling in to report how you use that money. One thing the guidance has also said is, you'll report use of payments using your normal method of accounting. So if you normally do it a cash basis, then you're going to use that method. If you do it on an accrual basis, you're going to do that method. One of the FAQs that they provide on the HHS website, someone asks about depreciation. And again, however you are going to do it for your accounting purposes, or you're going to depreciate it, if you're going to take it all in 1 year, or you're going to do it over time, then you just need to consistently do that, both for tax purposes and for Provider Relief Fund purposes. So again, you might want to think about that now that we're getting to tax season here. If you're a year end, if you have a year end financial year, then you might want to think about, okay, well, I bought this new piece of equipment. Do I want to take it all this year, the depreciation, so that I can use my provider relief funds, or am I going to do depreciate it over time? Does that make more sense from a tax purpose? So we've worked closely with accountants on this, and I've encouraged clients to make sure that they're in good, that their accountants are aware of this, and that they are going to be generating good documentation and consistent documentation for the Provider Relief Fund. And again, it's going to be important to say that documentation. It doesn't seem like come this 3-4 months from now, or whenever they get that portal operating, that you're going to be attaching PDFs of documents, of receipts, of proof of purchase, or things like that when you submit that initial report. But the federal the funds do reference federal regulations for keeping documentation of how you use the funds. The other component is, don't forget about audits. Recipients who spent more than $750,000 during their fiscal calendar year. So again, this is going to be hospitals and health systems will have received that amount of money for the most part, are subject to single audit requirements. This was a new term for me. It's always fun being a lawyer and learning new exciting things like what is a single audit requirement. So again, recipients of large amounts of federal funding have to perform an audit to be able to demonstrate that they use these funds properly. Again, and also, we anticipate that there will be some audits, independent audits performed by the government related to use of these funds as well. There's always a potential of, whistleblowers or that sort of situation as well. leading to a governmental audit or potentially like a False Claims Act case. All right, so that's all I have today. It was kind of a shorter one. These funds have been around for a while, but we wanted to address, one, highlight the fact that there was some, the government has kind of gone back to their original guidance on the issue of calculating lost revenue. Again, you can compare 2019 to 2020, or you can use projected revenue for 2020 compared to what your actual revenue was when you're determining how much lost revenue COVID cost you. And then the other component we wanted to highlight was the fact that the deadline for reporting has kind of now been dissolved. We don't currently have a deadline for when you'll be required to submit those reports online, but we do encourage people to go and register at the website. It does say it takes 20 minutes, so and there's a a guide available on the HH website. We can also help you kind of go through that process as well. As a provider relief fund, I see a question included for the single audit calculation for the 750. Yes, it is the answer to that question. Continue to monitor. We'll be sending out client alerts as things change, and I appreciate your time this morning.